Hi, Mr. CEO. From my recollection, actually, I don't have that much of a recollection that day because I was doing so many surgeries. However, from what I do remember, Mrs. Romanov came in as an emergent case that was discovered by one of my medical students. Whenever she came into my OR, I did not get a proper report from my resident because I was so focused on getting into the surgery because this baby's life was at risk, and so was the mother's. However, I should have taken the time to listen to my resident about what he had to say, and that would have helped the patient's outcome much more, as well as communicating with the anesthesiologist. I did not give the anesthesiologist proper time or communicate effectively to do his job. He was trying to do a spinal tap and insert an airway, however, it was just not working. The patient needed to be oxygenated, but my main concern was getting the baby out so it could survive. However, I should have taken the mother's life into risk as well. From what I do remember, after the surgery, the baby came out and was doing well, however, received a improper medication that put its life at risk as well. I wish I had taken the proper time to go see the patient. However, our staffing was not adequate enough and I was just slammed with surgeries all day. Being only one person, I can only do so much. I would appreciate to have proper staffing in the future. That way we can avoid these types of situations, because that's what I believe the situation has come down to, is a lack of proper staffing and a lack of effective communication. I believe that we could all do better in the future if we were to communicate more effectively, as well as actually have the time to go do so. However, that does not change the outcome of this case. I wish I was there for Mrs. Romanov as well as the baby. But I believe this can be avoided in the future if I communicate more properly with my teammates, as well as have the time to see all of my patients. From what I remember, that is my complete recollection of the case.